COVID-19 test results coming in more quickly in some parts of the U.S., while we see some more rural areas contending with major spikes in coronavirus cases. These are some of the things catching the attention of our national investigative team. Here's Investigate TV's Lee Zurich with our COVID-19 tracker.
When you look at the metro areas with the most per capita cases the past week, all but a handful are in the south.
So I think our fatality numbers are going to go up, and that is horrible, it's horrific, it's tragic, but I'm afraid that's what's going to happen.
In the last 2 weeks, when you factor in population, cases are growing more in the states of Mississippi and Florida than anywhere else.
It's really serious to be so high, you know what I mean? And it's a continual thing. It's continuing. It's not flattening out. So that means it's continuously on the rise, which is very dangerous.
The United States has had a full-blown outbreak in basically every locale now. There's very few areas that have been completely spared. Certainly population centers have not been spared.
Brownsville, Texas is the country's new COVID-19 hotspot. In the past 7 days, that metro area has seen an enormous spike in cases at a rate higher than we've seen anywhere else during the pandemic. In the past week, 1,200 out of every 100,000 residents have tested positive. During the heart of the spring outbreak, the hard-hit New York metro area's per capita rate was 342. While cases in the Brownsville area are growing, others like Dallas, Lubbock, and Midland, Odessa have lower per capita case counts.
We have a series of outbreaks. The outbreaks are not even state-by-state outbreaks. There are some states where there's worsening outbreaks in the north part of the state, and there's a stabilizing outbreak in the southern part of the state.
Deaths across the country are lower than April. As a country, we're now averaging about 1,100 deaths per day.
We are seeing a lower fatality rate for the average infected person. And that's for three reasons again. One of it is that we're testing so much more that we're finding many more lower acuity individuals. Another is that we're treating patients better, and that includes both new therapeutics as well as how we manage those individuals. And the third is that we're protecting our vulnerable population so much better.
As some schools start to reopen, experts say testing will be critical. While the number of tests across the country have hit a plateau, some areas are reporting better turnaround time for results, which was a problem earlier this summer.
For the past 3 weeks, due to the high volume and then our reference labs not able to get reagents in, we were getting up to 7 to 10 days. We have finally this week, we are back now to 2 to 3 days turnaround time.
Lee Zurich, Valley News Live.
And in addition to daily deaths remaining lower than our peak in April, our COVID-19 tracker also shows the number of people in the hospital each day across the country is also coming down, just very slowly.
If you've been wondering when you can finally buy as many Clorox wipes as you want, the company has a timeline. It's next on Valley News Live, 10 at 10.